And welcome everyone. We are recording today so that we can have the video and the session available to people at a later date. Farming, first aid, or anyone in agriculture or rural area, it is imperative that you know how to respond in a first aid emergency, because living on a farm or living rurally, there's so many advantages, but there also are a couple of disadvantages. And some of those clear disadvantages are things such as longer ambulance wait times and significantly greater travel times to tertiary trauma hospitals as well. So the more people that know first aid and what to do in these situations, the better. And the better outcomes we have for everyone, and it's everyone's responsibility. So thanks for coming along today and for listening in. So this is an express session over some of the key topics that are relevant to rural and agriculture and first aid. We're going to go through doctors A, B, C, D. I'm going to chat through when you would start CPR on someone and briefly how to do that. We'll talk about drowning, life-threatening bleeding, head injuries, if someone had a suspected spinal injury, and we'll briefly touch on crush injuries and snake bites as well. Please ask lots of questions as we're going through. You can just type them into the chat. Myself and Anna will be keeping an eye on those things as we move through. A couple of statistics. This is from 2021, but as Anna said, over the last 15 years, 13 to 15% of farm accidents have been children, and we haven't been able to improve that number at all. You can see there's a couple of other statistics there up on the screen that are from Farm Safe Australia from the 2021 report, and 87% of those involved in accidents are males, and 58% of those that are injured are actually over the age of 65. So there's a significant proportion of those that are injured that are male, and that aging population as well. So we're not going to go into why that is, but just a few little statistics. You can also see there that tractors and quad bikes are the leading causes of injury and also fatalities. Horses come in third at one of the leading causes of injuries, and then side-by-sides are the third most common agent of fatality on farms in 2021. So we're going to move along to doctors A, B, C, D. As I said, this will be quite fast moving. Doctors A, B, C, D is something that you would apply in all first aid situations. So if you're out on farm, if you're at home, if you came across a car accident, you're up in the back paddock, doctors A, B, C, D is something that everyone should know, and you apply it in every first aid situation. So you'd follow all the steps through. You would not skip one of the steps. You always follow the steps. So the first D is for danger. So making sure the area is safe. If there's any dangers, risks, or hazards to yourself, the casualty, or others, then where possible, you reduce, remove, and mitigate the dangers, risks, and hazards. They could be to the environment, or they could be specific to that individual as well. Within the farming and agricultural environment, there are obviously a lot of unique hazards as well. It can be quite a dangerous workplace. So making sure that you, turn off any machinery, eliminate any chemical sprays, whatever is around, that's a potential danger, isolating those. Then once the area is safe, you check if the person is responsive. So you could ask them a few basic questions such as, can you hear me? Open your eyes. What's your name? Squeeze my hand. If the person responds to you, then fantastic. You can, decide what first aid management they need from there. If the person does not respond to you, you need to send for help. So that may include yelling out, using a radio, tooting the horn, flashing lights, whatever you had available to try and gain the attention of anyone else if there was someone around. And of course, calling the emergency services. So calling 000 for us here in Australia. Then you're going to have the 000 call taker on the phone to you, talking you through the next steps, which is the A, B, C, D. So the next step for A, for airway, is to check in the person's mouth to see if there's anything that was in there that was obstructing their mouth, and making sure that their airway is nice and clear and open. If the person had vomit or had a foreign body in their mouth, you would need to roll them on their side and flick it out. Then once their airway is clear, you check if the person was breathing. So if the person is not breathing, so you'd look, listen, and feel to see if the person was breathing or not. If the person is not breathing, you need to start CPR. If you're not sure if the person is breathing, you also need to start CPR. If the person was breathing normally, then you would place them into the recovery position. And I've got some images that I'll show you that shortly. If the person's not breathing, as I said, you need to start CPR. So CPR stands for cardiopulmonary resuscitation. Cardio meaning heart, pulmonary meaning lungs, resuscitation. So you're starting CPR as soon as you can, and you're delivering compressions, and there's the option to deliver breaths as well to someone that needs CPR. If available, you would apply the nearest defibrillator as soon as you can as well. There's a very simplified version of this called call push shock, and this is often something that the Heart Foundation and the emergency services follow to help educate those lay people or anyone that's not a health professional, in addition to doctors A, B, C, D. So calling 000, pushing on the chest hard and fast, and the shock is applying the defib as soon as possible. So when providing compressions to someone, you provide 30 compressions, 2 breaths, 30 compressions, 2 breaths. If you don't want to provide compressions to that person, if you don't want to provide breaths to the person because you don't feel comfortable, you're not willing, or you're not able to, then you don't have to. You would just deliver continuous compressions. When you're delivering compressions to someone, the technique will differ depending on the size of the casualty. So if it's an infant under the age of 12 months, you will use 2 fingers to compress down 1/3 of the chest wall, making sure your fingers come all the way back up, 1/3 all the way back up. You're pushing down on the chest 120 times per minute, so it's quite quick at 2 per second. If you were to decide that you would like to deliver breaths to the baby, for a baby, put your mouth over the nose and mouth, puff of your cheeks is enough of a breath for a baby. For a child, so a child is between the age of 1 and 8 years of age, just using one hand as a guide to push down 1/3 of the chest wall. Still pushing down at 120 compressions per minute. 30 compressions, 2 breaths, 30 compressions, 2 breaths. You would continue with that. For an adult, you need to apply compressions using both of your hands. So the heel of your bottom hand, arms straight, your shoulders over the top of your hands, pushing down 100 to 120 compressions per minute. So 2 per second. You're pushing down a significant depth, at least that 1/3 of the chest wall. It's really uncomfortable. But remember, by you pushing down on their chest, you're manually pumping that blood around their body. So you're manually pumping the blood to their brain. And of course, your blood contains oxygen. So by you providing CPR, you're keeping the brain cells alive, which is the aim of CPR. A lot of people think that you're trying to restart the heart. It's very unlikely that you're going to restart the heart from compressions alone, despite what medical TV shows and movies make you believe. But of course, you continue to provide compressions to the casualty for as long as required. So until help arrives, if there's an unmanageable danger, if the person woke up, or if you're physically exhausted. The last D in Doctors A, B, C, D was locating and applying that defibrillator. There have been a lot of grants and a lot of competitions that have been available of recent where farmers have been able to apply for grants, and there's been quite a few competitions as well. So you may have a defibrillator on your property. If not, you may know where the nearest one is, or it may not be relevant to you. A couple of statistics about cardiac arrests. So there's about 30,000 cardiac arrests in Australia per year. Only 1% of these are pediatrics. So 99% of the time when someone has a cardiac arrest on a casualty over the age of 16. And so it's important to start CPR as soon as possible, because every minute that compressions are not delivered, the survival rates decrease by 10% a minute. So 10 minutes without intervention causes near irreversible brain damage. So important, if there's any doubt in your mind, that you start compressions and you start pumping that blood and therefore oxygen around the body. It's also important to remember that only 10% of people survive cardiac arrests, and that survival rate can significantly depend on what's caused the person to have a cardiac arrest. So cardiovascular heart disease or something happening to the heart is by far the most common cause of a cardiac arrest, but it could be a traumatic incident that has happened, and those injuries weren't compatible with life, and that person was never going to survive. Or sometimes it may be that there's an electrical malfunction within the heart and that person needed CPR and needed that defibrillation, that shock, to get their heart back into the right rhythm. That is one of the quickest ways that I've ever taught doctors ABCD. But if you have any questions or you'd like to clarify anything, please write it in the chat, because like I said, that is really quick. I know that most of you have probably completed some form of CPR training before, so I didn't want to spend too much time on it, even though it is really important that everyone knows how to provide CPR. If someone was knocked out and they were breathing normally, so perhaps the easiest way to remember that this is, if someone was intoxicated or drug affected, you would never leave them flat on their back. And the reason why you wouldn't do this was because in case they were to vomit, they may aspirate or choke on their vomit. All of your airway muscles become really relaxed when you're unconscious on your back. So it's important that the adult is, all ages are placed into recovery position. You can see these 4 steps here. So the arm that's furthest away from you, putting that out at a 90-degree angle, lifting up the knee closest to you at a 90-degree angle, and place your hand on their shoulder and their hip and roll them forward. In step 4, you can see that the first aider is hyperextending the casualty's neck as well. So when you put someone in the recovery position, you want to make sure that their airway is open. You don't want to put someone in the recovery position for their head to be down because their airway is not protected. If that was an infant that you're putting in the recovery position, an infant's head should always maintain in a neutral position. You should put an infant's head back. And for a child between the age of 1 and 8, you only slightly extend their head back. So just keeping in mind there's different airway positions as well. When you're placing someone into the recovery position, they're obviously unconscious or in an altered conscious state. So it's important that you keep a really close eye on them in case anything changed, and you've got help on the way to you to help manage the casualty. Any questions going, Anna?
Not yet.
Perfect. All right, so the next topic we're going to talk about is drowning. So drowning, as we're all aware, can occur very quickly. It only takes 20 seconds and a few centimeters to drown. In addition to the normal, bodies of water that we have around the home, there's also additional drowning hazards around an agricultural property or a farm as well. So there could be dams, troughs, buckets, big potholes that turn into puddles, trucks coming in and out, and heavy rains. So just being mindful and thinking about where there are any potential drowning hazards. With the children that have drownings, it's actually 78% of drownings are children falling into water. So again, just thinking about that, thinking about anything that can hold water. So any sort of bucket, or, think about the bucket on the front of the tractor. If that is on and it has a big rain, like that's potentially a drowning hazard, anything that can hold water. So if someone was to drown, someone was in a body of water, you follow the doctor's ABCD. The dangers, obviously the water, checking if they're responsive. If you're pulling them out of the water, it's very likely they're unresponsive. You'd send for help, check their airway, check their breathing. If they're not breathing normally, you're not sure if they're breathing, then you need to start CPR. So it's gold standard and it's best practice that breaths are delivered first in a drowning. And that is because the reason why the person's unconscious and their heart is stopped is very likely because they've had a lack of oxygen within the body. So by you delivering those 2 breaths first, 30 compressions, 2 breaths, 30 compressions, that actually significantly helps with the casualties' survival outcomes as well. In some situations when someone's had a cardiac arrest, breaths aren't as important, but breaths are really important in any person that's drowned, so a child or an adult, and all infants and children that require CPR, breaths are really helpful in their resuscitation. So yeah, if like best practice and gold standard is to deliver those 2 breaths first, 30 compressions, 2 breaths, 30 compressions, and you would keep going. If there's a defibrillator available, that would also be applied. The person would need to be dried so that the pads would stick to their chest. Next, that is bleeding. So if someone was, it could be capillaries that are cut. So if someone was bleeding from capillaries, that's like a paper cut or a graze of the knees, you can simply apply direct pressure. If someone's cut through a vein, the blood is a dark red color that's flowing out. You think of it when you get a blood test, it does flow out. So depending on where has been cut, if it's to a limb, elevating above the head is really helpful. And of course, applying direct pressure for the bleeding. And then, of course, we've got the life-threatening bleeding, which we'll talk about. I've got another slide on that in a moment. But if there was an artery that was interrupted, that had been cut, that had, been impacted with an artery, it's likely that you'll see spurting blood. Every time the heart beats, it's pulsatile blood flow. So someone can actually bleed out. They can lose their blood circulating volume quite quickly. So that is a medical emergency, and that certainly needs direct pressure and an ambulance. A couple of other things about bleeding before we talk about life-threatening bleeding is that if someone ever had an embedded object, so they've, I don't know, a nail has gone through a finger, or they've got some sort of rod or a pipe or some little drill bit, whatever it may be, embedded through their arm, it's important that you never remove that embedded object because it could be sitting up against an artery. If you pull it out, you might cause an arterial bleed. So you'd leave the object in there, bandage around it. If it's to a limb, again, elevate and seek medical attention. If a body part was amputated, sounds really dramatic, but a lot of the time these amputations are fingers, and it could even be a partial amputation or fingers and hands. You need to, of course, apply direct pressure to stop the bleeding. Then with the amputated body part, so maybe part of the finger, place that in something that's really clean, for example, like a snap lock bag, and then place that snap lock bag into sort of cold slushy water. And that keeps the amputated body part in the best possible condition for it to be reattached. Certainly do not put it in water. It makes it really challenging for the plastic surgeons to reattach. Someone's got a blood nose, pinching down the soft part of their nose and leaning your head forward. Someone's got a blood nose and you put your head back, the blood just runs straight down the back of your throat into your stomach, so we certainly want to avoid that. Placing an ice pack on the back of the neck is also helpful if someone has quite a severe too. All right, so life-threatening bleeding. This is when, like I said, this could be from some sort of a trauma or some sort of big accident. Apply direct pressure, do whatever you can to control that bleeding. Do not remove the first bandage. Once you've got a bandage on there, you place another bandage on top. You would need to use a lot of pressure, whatever you had available, your t-shirt, whatever was around, you would use that to apply the direct pressure. And of course, you're calling for help, so you're calling an ambulance. If it's to a limb and you're applying direct pressure and you can't stop the bleeding, then as a last resort, you would use a tourniquet. So whatever you had available, a belt, some twine, a shoelace, many things that you may have available to you, a piece of clothing, you would apply a tourniquet. So you would apply let's just say the belts in this example, to the limb 5 centimeters above where it's bleeding, and you keep making it tighter and tighter and tighter until the bleeding stops. So you're stopping all of the circulation in the limb. Note down the time that you place that on. And of course, you're letting the first responders or paramedics know that you've applied a tourniquet, because it is compromising the blood flow to the limb, but it's much more of a priority to do that than to allow the person to continue to bleed, because if they continue to bleed, they're not going to have much blood left in their body after a few minutes. So yes, tourniquet as a last resort. Applying direct pressure is absolutely the priority. Does anyone have any questions? Head injuries. So if someone hits their head, the priority is absolutely and always managing the airway and the breathing whilst you're caring for the neck. So someone may suffer a head injury from falling off a high height. They could be have an accident with an animal, with some machinery, bites, lots of different ways that someone can suffer a head injury. I work in an emergency department, and we see a lot of children that I work at the children's hospital, so I only see children that come in with head injuries from like motor vehicle accidents, so on a road or in a paddock, wherever. And then, of course, motorbike, quad bikes, side by sides, and all type of vehicles and things as well, horses as well. So if someone is ever knocked out, so they have a loss of consciousness, you would need to call 000. If someone is confused or they have an altered level of consciousness, again, you would need to call 000. If someone had a seizure, you would need to call 000. And if that person suffered a head injury from a high height or a high speed relative to their size, you'll need to call 000. So if someone has sustained a head injury because they fell off the top of the shed roof, then that certainly warrants an emergency presentation or an ambulance trip as well. Sometimes the symptoms of a head injury don't always present immediately. They can be slightly delayed as well. So make sure you're keeping a really close eye on the casualty. It's really hard sometimes with, you know, what you prioritize. Like, of course, in a perfect world, everyone would be wearing helmets all the time and following all the instructions, but helmets is certainly something that you should try your best to be super strict on. Because I've looked after many children, and the only reason that they're alive is because they're wearing a well-fitting helmet. So that's something that I'm pretty passionate about. If someone has a suspected spinal cord injury, so if they, again, were in and they had fallen off a horse, or they'd come off the back of a ute or something like that, and you suspected or you're worried about their neck or their spinal cord, you would not move them unless they're in immediate danger. So signs and symptoms that someone may have a suspected spinal cord injury is that they could have pain and tenderness to the neck or length of the spine. They could have a weakness or inability to move their limbs. So it could be upper limbs, lower limbs, or both. They could also have an altered sensation, so tingling, pins and needles to their limbs. And in some really severe cases, the person could actually have breathing difficulties, nausea, or they could even have a cardiac arrest. So if the casualty was unconscious and they're unable to tell you how they were feeling, then you would assume that the person has a spinal cord injury and not move them unless their airway and breathing was in immediate danger. So unless they needed CPR, or unless they were in immediate danger, like there was a bushfire or something like that. You'd call 000 and maintain that neutral spinal alignment. So you might be crouching down behind them and keeping their head in that nice neutral alignment. And if the person was sort of opening their eyes and trying to move, reminding them, you know, you're okay. I'm just making sure that you're safe. Stay still. Help is on the way, and talking to them. But yeah, certainly only moving the casualty, to recap that, if they are in immediate danger, or if they need CPR, essentially. Snake bites. So this is our last topic that we're going to talk about. So it's a really common misconception that people think that when someone's bitten by a snake, that the venom is injected straight into the bloodstream. However, this is a myth. The venom goes into the lymphatic system, and then the lymphatic fluid travels around the body with movement, and then the venom enters the bloodstream by the lymphatic system. So you would treat all snake bites as though they were venomous and as though they had injected venom into the body until proven otherwise. I know that there's some snakes that are not poisonous, but depending on where you live and depending on your knowledge and experience of those snakes, the advice from the Australian Resuscitation Council is that you treat all snake bites as poisonous. You may live in an area where there's lots of snakes. Certainly the area that I live in, there's lots of poisonous snakes around the summertime, and we have a snake bite bandage in every single vehicle. So make sure you consider having snake bite bandages or snake bite kits if you're living in these high risk areas. And if you have young children as well, making sure you're educating them if they were to ever be bitten by a snake, to sit straight down, not to run back to the shed or the ute or the house, because by you sitting straight down is significantly slowing down the spread of the venom, because your lymphatic fluid only moves around your body when you move around your body. I also teach primary schools as well, and I was at a remote primary school on the border of Victoria and South Australia last year, and I asked a prep class what to do if someone was bitten by a snake, and this prep said to me very eagerly, put his hand up and said, if you get bitten by a snake, you have to stay still, because otherwise the snake juice will move around, will go around your body and you will die. I was like, that's kind of correct. His parents obviously done a great job of educating their boy on the importance of remaining still if you're bitten by a snake. So you would call 000, make sure the person was as still as possible, and you want to apply something called the pressure immobilization technique. So if you had bandages available, if you had snake bite kits available, you could use a crate bandage and bandage directly over the snake bite site, like the injection site. And then you would use a compression bandage. So really the same type of bandage you'd use for a sprain or a strain. You can see on the screen that there are compression bandages that are specifically made for snake bites, because they have a snake bite indicator, and that tells you how tight to apply the bandage. So you could use your snake bite bandage and always applying from the extremities inwards. So starting down at the toes and going up towards the hip, or starting at your fingers and moving your way up to the shoulder. Ensuring that there are no gaps and that even pressure is applied as you go up the limb. The last step of the pressure immobilization technique, after you've applied the bandages, is to then immobilize the limb. So if there was a stick or a splint or something available to help immobilize the limb, you would do that. It's just more of a constant reminder to keep the limb still. If it's the other person's leg, the best thing to do is actually just tie the person's legs together, because that acts as a great splint, the other leg. And particularly if it's a child as well, because your definition of asking a child to stay still is often very different to the child's definition of staying still. But yes, just be mindful of where, the snakes can potentially be, and making sure that you know where your nearest snake bite bandages are. If there weren't any snake bite bandages available, you would need to, or compression bandages for that matter, you would need to take off a piece of clothing, whatever you had, and apply that, remain still and wait for help to come to you. I do have a really quick slide on crush injuries, and crush injuries, again, we do see these that happen in agricultural and on properties, on farm. So a crush injury occurs when the body or a body part is trapped, pinched or jammed under or between objects. Machinery, repairs, rollovers, animals and heavy equipment can all cause crush injuries, of course. Pressure can harm the skin, the muscles, the nerves, the bone, depending on the degree of the force. It can also sometimes cause partial amputations as well. Most commonly, hands and fingers are what become crushed. These can occur with repairs and maintenance of machinery, rollovers, any sort of accidents. Like I said, a traumatic amputation can sometimes happen as well. You would do your best to remove whatever the person was crushed between or by as soon as you could, and calling 000 if there was evidence of significant injury or if the mechanism of injury was really severe. There is something called crush injury syndrome that sometimes people ask about in first aid courses and something that they're mindful of. And that's not something that happens immediately. That's something that happens over a longer period of time. But certainly the priority is trying to free that person or free their body part, talking to them and making sure help is on its way. Yes, there's a few different resources that you can look up for this. Kids Safe Australia are fantastic, and there's quite a few resources. So for me, I'm in Victoria, so Kids Safe Victoria is a great resource where there are a lot of tips and tricks, but I would start off by ensuring that your child, you taught them their address and how to call for help, so how to call an ambulance. Particularly if you're in quite a rural or remote area where they can't, just whip next door to the neighbour or something like that. I think calling for an ambulance is really important. And then I guess it depends on if there's any specific dangers to your situation. So within your farm, or if anyone has any health concerns. So if a family member had epilepsy, you'd talk about what to do if you couldn't wake someone up, or if they were waking and weren't talking to you, or what to do if you saw a snake. And if you do live on a property where there are snakes at different times of the year, educating the child, this is what snakes look like, teaching them that, they won't harm you if you don't sort of scare them or harm them. But maybe you could even take them around the property and say, snakes like to live underneath something or somewhere where it's really warm. So these are the particular areas where the snakes may live, for example. I'd sort of work through a few scenarios that you think might happen, or when you're not there or you're not immediately there, or if something happened to you, of how you'd like your child to respond. So you're definitely calling 000, and what to do if you couldn't wake up mummy or daddy, I think is by far the next most important thing to do. You can get such great little doctor's kits and things like that where you can role play, if someone's bleeding, to bandage it up, and a few things like that. Yeah, so defibrillators are an expensive outlay. They're between $2,000 and $2,500. The defibrillators are an investment piece. They do have really great warranties on them, where a lot of the defibrillators, my favorite defibrillator, it's really easy to use, is low maintenance cost, and it also has an 8-year warranty on it. So it's guaranteed that it's going to last for at least 8 years. And as you said, Anna, I think that the best place, we supply a lot of defibrillators to farms, and the best place is often in the vehicles, so within the ute with the first aid kit, particularly if you've got a large property and you're often moving around. If you had a farming or agricultural property where you employ a lot of people, the workshop may be a suitable location, but for most farmers it's where their ute is. Yes. Yeah. Currently at the moment, what are we, May 2023, that's a defibrillator is classified as an asset, and so these assets are, of course, check with your accountant, but you can use them as an instant asset write-off as well. Yeah, it really depends on what causes the cardiac arrest. So, a child could drown and that causes a cardiac arrest. Someone could chop off their leg and there's no one there, and they could literally, bleed out and have a cardiac arrest. All of these horrific things are things that can cause that cardiac arrest. The most common cause for cardiac arrests is a heart problem. So the heart's goes into a funky rhythm. So it's sort of just like spasming instead of pumping properly. And adults that have a regular rhythm, it's often sudden with no warning for those that have an electrical malfunction in their heart. But if they receive CPR and they receive a shock, a defibrillator shock in really good time, they have a really high survival chance So in comparison to someone that has been involved in a huge accident, or, a child that's had an anaphylactic reaction, their airway swollen over, for example, they need different things to help reverse what's caused their heart to stop. So if someone's had a cardiac arrest and CPR is in progress, the survival chance is only 10%. However, if you apply a defibrillator within the first 3 minutes, their survival rates increase by about 70%. So those applying of the pads, having that defibrillator available is really key, particularly for adults, in increasing their survival rates. And I think there's always a lot of confusion in the community between heart attacks and cardiac arrests, and they're really different. And because someone could have a heart attack and it could almost immediately lead to a cardiac arrest, or someone could be having a heart attack for a few days or even a few weeks. And then if it's left untreated, their heart would eventually stop. And certainly those people that have heart attacks, that can be a warning sign. They may get those typical heart attack symptoms of that crashing chest pain, some pain to the shoulder, down the arm, radiating up the jaw and the neck. So after a mild concussion, the person always needs a medical assessment, because you want to prevent sort of overstimulating the brain before going back to work or going back to sport, particularly if it's contact sport. And also keeping in mind that just because a person's okay immediately or 2 hours after the head knock doesn't mean that they won't develop any symptoms. Sometimes there can be delayed symptoms as well. If you think about a concussion, it's essentially like a bruise in the brain. And so, as you said, Anna, there's such varying levels of a concussion. The brain is this delicate organ that's within a bony, ridged structure. And so often it's that movement that causes, this bruise in the brain. And so certainly rest, like decreasing the screen time and really taking it easy. And it's also very challenging for people that are self-employed or that are farmers, because they don't like to do either of those things. And I can say that because I'm from a long line of farmers and I've married into a farming family as well. And they're often not great at resting or taking on medical advice. But that certainly is the priority, because you want to prevent some, potentially worsening the concussion or drawing out the symptoms for a longer period of time as well. So yes, not a lot of screen time, more resting, and an assessment by a doctor before heading back to physical activity or work. It's a normal compression bandage, so they're 10 centimeters wide, and you can get them in 4 meters or 10 meters when they're stretched out. And the bandages, it almost kind of looks like train tracks on them. And then when you pull the bandage tight, the rectangle turns into a square. So when it's a square, that's how tight to apply the bandage. And then if you pull it too tight, it will become a rectangle again. So then that's too tight. If the snake has released venom into your body, the moment you start moving and mobilizing, that venom's pumping around your lymphatic system, it's going to go into your blood system, and that's when things get really hairy and really critical. Improvising with whatever you have available, a piece of clothing item, and remaining still, keeping that ligament mobilized. But hopefully you've got, like you said, a two-way, some sort of radio or a phone where you can send for help and to get someone's attention. So Emergency Plus app is a fantastic app that is by the governing bodies, so the Australian Government, Police, SES, CFA, or the Fire Brigade, and paramedics, and it helps you to determine your location. So in all first aid courses, I always tell everyone to download this app, and the reason why this app is so great is because it provides you with the residential address if there is one, so the property number, street or road name, and the town or suburb. It provides you with your latitude and longitude coordinates, but it also provides you with 3 words. And these 3 words are really relevant, particularly if you're somewhere remote. And the way that the 3 words works is that over all of Australia, there's a 3 meter grid. And so you can think about that grid that's placed over Australia. So each 3 by 3 meter square has 3 words specific to that exact location.
Really?
So if you knew that you're in the paddock up behind, paddock, whatever, up behind the hay shed, yada, yada, and you don't actually access it by a particular road, you need to access it via wherever that may be, and you're trying to get air traffic to land to you, you can say to 000, hey, I've got my 3 words.
Wow.
And you'd say those 3 words, and it might be like cat, house, grass, and they can pinpoint exactly where you are. It's an orange looking app. It's called Emergency Plus. And the 3 words will work even without phone reception as well. I hope that you found, and the others that have been on today and that will watch in the future, find the session valuable. And if anyone ever has any first aid related questions about courses or about first aid kits or defibrillators, please reach out. As you said, my details are on the screen, but you can also just Google Rhythm First Aid in on farms and in rural areas is something that's pretty close to my heart and something I'm pretty passionate about. So I'm always really open and happy to help people.